Testing, testing, testing. Okay. That one is good. Test, 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 test. Testing. Okay.
Serving 900,000 people, Island Health's focus is the health and wellness of the residents and communities on Vancouver Island and in surrounding coastal communities. Our diverse geography spans 48 settler communities and 50 First Nations, from the Zawazadenuk people of Kincombe Inlet to Victoria, from Tofino to Comox. It is our privilege to provide health and care services on the traditional unceded territories of the Coast Salish, Kwakwaka'wakw, and Nuchalnuth cultural families. We acknowledge our commitment to truth and reconciliation with First Nations, Métis, and Inuit people. The Island Health family includes 30,000 healthcare professionals and 1,500 dedicated volunteers. Over 3,000 doctors, nurse practitioners, midwives, and dentists make up our medical staff. We provide health and care services at 287 sites and facilities with more than 5,800 long-term care beds, over 1,200 mental health and substance use beds, and more than 1,800 acute care and rehabilitation beds. Island Health has an annual budget of $4.2 billion. Each year, this funding supports 474,000 visits to emergency departments, 73,000 surgeries, more than 61,000 MRIs, 175,000 CT scans, more than 165,000 visits to urgent and primary care centers, 506,000 professional service visits, 60,000 adult daycare visits, and 3.7 million hours of home support. Island Health has expanded our primary care services with same-day access to primary care at 3 urgent care clinics, 7 urgent and primary care centers, 2 community primary care clinics, and 1 after-hours primary care clinic. Under the leadership of 8 medical health officers, Island Health works to promote health, prevent disease, and improve quality of life. Each year, we conduct more than 2,000 inspections of childcare facilities, 500 inspections of licensed care facilities, and 5,400 inspections of food service operations. Public health nurses provide nearly 6,000 perinatal home care visits and 30,000 childhood immunization appointments each year. From before birth to end of life, Island Health strives to provide excellent health and care for everyone, everywhere, every time.
It means you've done something good, or it's a debt of gratitude from me to you. And just say shakshaklayatsu for all of you for coming out and engaging with people. And please keep up the good work. Thank you. Chooch.
Thank you very much, Chief Watts. And yes, I was going to mention that Ken was on the board too, and we had lots of learning experiences together, I think it's fair to say. We appreciate you being here today, and I'm very grateful for you welcoming us as visitors to live, work, and care within the Sayshot First Nations traditional and unceded lands. We do this to reaffirm our commitment and responsibility to improving relationships between nations and cultivating our own understanding of Indigenous peoples and cultures. Please join me in reflecting on the harms done, such as the cultural genocide and assimilations of Indigenous people, the residential school system, the discovery of graves of Indigenous children who attended them, and the too many missing and murdered women and children, and the social inequalities and racism which exist today. I invite you to think about our responsibility to act in a spirit of reconciliation, healing, and collaboration. As a healthcare organization, Island Health is committed to cultural safety and humility, and we demonstrate this through our actions to address Indigenous-specific racism, systemic racism, and the ongoing impacts of colonization. Public forums like this allow the board to meet the people and communities we serve and are essential to our commitment to transparency and accessibility. Our time together will help us better see what matters most to you, so we can increase our understanding and refine our thinking. As a governance board, we are responsible for the overall direction of Island Health. The Minister of Health appoints the board, but we each choose to sit on the board because we care deeply about health and care. As a former nurse, Deputy Minister of Health, and Chair of Canadian Blood Services, the patient has always been at the center of my work. I always ask myself, is what I am doing right for the patient? Caring for patients is, after all, why I started working in healthcare. Caring is also why every member of the Island Health family is dedicated to delivering Island Health's vision of providing excellent health and care for everyone, everywhere, every time. Now it's my pleasure to introduce you to our directors who are responsible for Island Health's overall direction. In addition to myself, the board includes Shawnee Cassavant from the Hupechasat First Nations, Ron Rice, a member of the Cowichan tribes who lives in Victoria, Andy Adams from Campbell River, Ann Davis from the Comox Valley, Ann McFarland from Victoria. And unfortunately, 3 of our board members could not be here today. Harold Cull from Colwood, and our 2 newest board members, Joanna Gislason and Dr. Morgan Price, both from Victoria. Our local leadership and executive management team members are also joining us, and you will hear from some of them later. I hope you'll get the opportunity to speak with some of them before the evening is over. We have a full program, as we always seem to do at these events. The Vice President of Population and Public Health and Chief Medical Health Officer, Dr. Reka Gustafson, will speak about regional public health and wellness. We'll then have a presentation from the Hoosh to You Society. I'm getting close, I think, to that. The last part of the agenda will be an opportunity for you, community members, who have come to our meeting or submitted questions by email in advance to listen to the answers to the questions that you have submitted. But first, I welcome to the podium Island Health's President and CEO, Kathy McNeil, who will provide an update on the delivery of health and care services across Vancouver Island and Port Alberni. I'll move that.
Thank you, Leah. And good evening, everyone. And thank you for joining us online, and those of you in the room to take the time tonight when the Blue Jays are playing to be here. Thank you so much for counting us number one. And I just really want to express my gratitude to Amish. I actually felt really emotional listening to your acknowledgement of our team. And you personally know the road that we travel is never a smooth one. And so just really clicko to you. The partnership is critical to solving some of these really challenging situations we find ourselves in healthcare today. And so really grateful to you for your welcome and for your partnership and collaboration and knowing that you have many things on your agenda. So thanks for being here with us tonight. So I just wanted to say what a privilege it is to come here to this beautiful part of Vancouver Island, Port Alberni, and just the drive in and getting into the Alberni Valley. And I know a community that's rich in history, resilience, and lots of heart. And I was reading as we were getting ready to come and meet you today. I think it was the last COVID Speaks survey. Reka, you can correct me if I'm wrong. I probably am wrong. But what I read was Port Alberni, Alberni Valley, had some of the highest scores in terms of happiness. And I thought, you really know how to live life fully. So there are challenges, for sure. But there are ways to find happiness and joy. And so I think there's some lessons we can learn about how you live here in the Alberni Valley. As CEO of Island Health, it's a privilege that I feel very privileged to hold that role. We're here tonight not only to speak, but also to listen. And that's more important than ever before. To hear your stories, your concerns, and your hopes for a health system that truly reflects the needs of this region. So I'm going to hop right into the juicy parts. I'll start our conversation with the challenges related to primary care. Okay, thank you. And then can I just do this? There, is that working? Great. We know that primary care is the front door to the healthcare system, and timely access to a family physician or nurse practitioner is essential. Most of the services in healthcare you access through primary care. That's why we're working as partners with the Port Alberni Primary Care Network and the Central Island Division of Family Practice, who are leading the expansion of team-based care, bringing together physicians, nurses, social workers, and Indigenous health advocates to provide coordinated wraparound support. As of the end of August, 108 people have been newly attached to a primary care provider here in Port Alberni. Of the approximate 18,000 residents here, more than 1,900 are registered on the Health Connect registry who don't have a primary care provider yet. And I would say for anybody who's looking for a primary care provider, whether that's a physician or a nurse practitioner, please register on that Health Connect registry so we know where you are and we can access you when people are available to take new patients. Currently, about 78% of the population have a primary care practitioner. 6% are actively seeking care, and there's about 18% of the people who still appear to be unattached to primary care. Improving access to care requires that we have the talented people to provide that care. And Port Alberni continues to demonstrate what's possible when strong partnerships and community-driven solutions come together. Over the past year, meaningful collaboration between Island Health, Indigenous leaders, the City of Port Alberni, and the Alberni-Clayoquot Regional District and local health partners have strengthened our collective approach to recruitment and retention. And as Wamish has shared, it's when we come together we'll have the greatest success around recruiting and retaining the talented people we need. Together, we've resumed a joint physician recruitment committee, coordinated social media campaigns, and organized welcome initiatives, including housing support, childcare navigation, and spousal employment opportunities. These efforts are backed by national outreach and targeted marketing across Canada, the US, and the UK under the banner, "Come for the work, stay for the community." A dedicated recruitment and retention coordinator, Allison Sundstrom, meets bi-monthly with community partners to drive local action and sustain momentum. Hiring is underway for a third nurse practitioner at the Island Health Port Alberni Nurse Practitioner Clinic that we have here. A new locum physician has been secured through this year and is actively connecting with local family physicians. And a US physician recently toured Port Alberni and is considering relocating here. While we continue to rely heavily on locum physicians to staff the emergency department, we are actively recruiting to stabilize staffing through targeted recruitment and retention strategies. And we're starting to see success through the Clinical Associate Program at the Emergency Department of West Coast General Hospital, where senior residents returning as locums and the recent addition of an associate physician help ease the workload and improve patient flow and the experience of delivering care. I also want to take a moment to recognize the unwavering dedication of our clinical and operational leaders who have gone above and beyond to ensure that the emergency department shifts are filled and services remain available. At West Coast General Hospital, the emergency department sees an average of 68 patients per day, with the busiest days seeing more than 80 patients. Unfortunately, long waits mean that some patients leave without being seen, a reality that we're working hard to change. In a time when health systems across the country are stretched thin, our teams here in Port Alberni have shown extraordinary commitment. They've stepped up, often at personal cost, to make sure care remains uninterrupted and available to you. That kind of leadership doesn't always make headlines, but it does deserve our appreciation. I'm pleased to welcome Dr. Tom Doran as Chief of Staff at West Coast General Hospital. His focused leadership is instrumental in building a stronger, more sustainable healthcare system here in Port Alberni, and he lives here, and that's really important. Alongside leadership, advances in technology continue to shape the future of West Coast General Hospital. Since the installation of our upgraded CT scanner in February, West Coast General Hospital has seen transformative improvements in patient care and workflow. The upgraded CT technology allows us to safely image children with confidence. Its advanced capabilities have enabled us to expand services in Port Alberni, including offering cardiac CTs, made possible by technology that maps the heartbeat and captures detailed images of the heart without motion. In 2023-24, over 7,500 CT scans were performed at the hospital, and that number rose to 8,300 last year, and we're on track to exceed that even further this year. In 1 year, CT scans increased by more than 10%. In March of 2024, West Coast General introduced a state-of-the-art 3D mammography system, enhancing breast cancer detection through AI-assisted imaging. And in October of 2024, West Coast General introduced an advanced digital X-ray system, enhancing diagnostic accuracy and patient care through an automated equipment positioning and improved image clarity. The technology keeps changing in these diagnostic areas. And together, these cutting-edge imaging technologies are elevating the quality, safety, and timeliness of diagnostic care here at West Coast General, ensuring patients receive faster, more accurate results, and then better health outcomes right here in your own community. As Wamish said, what's really important is the experience of care and ensuring that that experience is culturally safe. At West Coast General, we're taking meaningful steps to ensure that Indigenous patients and families are safe, respected, and supported. And we recognize there's still significant work to do. Over the past year, under the leadership of Jess McConnell and Kelly Walsh, the site has taken this work seriously. They have a deep commitment to improve the environment and culture, to root it in respect, safety, and accountability. One of the most encouraging developments that has been the growing strength of our Speak Up culture at this site, especially when it comes to addressing Indigenous-specific racism and discrimination. Staff and patients are feeling more empowered to raise concerns. New training and policy have enabled leadership to respond with greater humility, urgency, and action. And these tools are helping us listen more deeply and act more decisively. Importantly, we know our work in this area extends beyond policy or training. A cultural shift is needed to reshape how care is delivered and experienced. The team at West Coast General includes 3 Indigenous liaison nurses and 3 Indigenous patient navigators. These team members play a vital role in supporting Indigenous patients and their families, whether admitted to hospital or receiving care in the emergency department. They provide compassionate, culturally safe care by offering advocacy, comfort, and assistance with accessing health benefits, including travel and accommodations. They are integral members of our multidisciplinary team. They not only support patients throughout their care journey, they teach those non-Indigenous members of the healthcare team every day. We're working to strengthen our partnerships with local Indigenous communities to better understand their citizens' needs and provide more responsive care. Caring for our communities and elders within them is a sacred responsibility. At Island Health, we're enhancing long-term care by improving admission processes and developing programs that prioritize independence, dignity, and connection, making care truly feel like home. We've expanded family support through our community access line and case management, offering guidance and advocacy every step of the way. Beyond facilities, our community health services deliver compassionate care directly in people's homes, including nursing, rehabilitation, and daily living support to help people live safely and independently. From last year to this time, we provided more than 43,000 hours of home support in Port Alberni. This year, we've already surpassed this and provided more than 44,000 hours. We're enhancing community-based services by implementing respiratory therapy and diabetes management in the community. Our community virtual care program is now available 7 days a week, offering nurse-led remote monitoring and expanded caregiver support. It's free and accessible to all island residents, and a referral is not needed. It makes care more convenient and connected than ever before. Because we know connection matters. Loneliness is a risk factor for frailty, and it reduces quality of life. Together, these services are improving health outcomes, reducing hospital visits, and helping people feel more supported and connected, both within their homes and across the community. We know how much this community feels the impact of mental health and substance use. In Port Alberni, we operate an overdose prevention site alongside sobering and assessment services that offer compassionate, low-barrier access to care. In response to community input from local nations, the city and partners, we're working to open 8 stabilization and supportive recovery beds. We've just signed contracts with the providers, and more details will follow in the coming weeks. These services are designed to meet people where they are, providing vital support and seamless connection to broader health and social services across the continuum of care. It's part of our commitment to fostering dignity, safety, and hope in every community we serve. To better support adults, we are working toward a single access point for timely, compassionate care when people need withdrawal management and detox, often the first step in stabilizing people with substance use disorders. Island Health offers the Mental Health and Substance Use Service Link, which connects people to vital community services, including harm reduction, addiction medicine, withdrawal management, and recovery. Anyone can call 1-833-804-8111 any day of the week to speak directly with a trained call taker who can get help that you need. Like other health systems across the province, across the country, and pretty much across the world, we're navigating a period of sustained, unrelenting demand. Now, new fiscal constraints upon us and ongoing workforce challenges. We're often referring to that as the trifecta. While these pressures are not unique to us at Island Health, they are deeply felt by our teams and by our communities. This moment challenges us to change how we deliver care so we can sustain the services that people need and meet that rising demand with the constrained resources that we have. We're focused on making smart, organization-wide improvements to how we work, from contract management to clinical and administrative workflows, so we can better deliver care while using every dollar wisely for patients. Looking ahead, our focus remains on investing in frontline services and creating a system that can adapt, grow, and meet the evolving needs of the communities we serve, a system that truly reflects the needs of the region. Before I close, I'd like to highlight the incredible efforts in the Alberni Valley to protect vulnerable residents from extreme weather events, such as heat waves and wildfires. Since the 2021 heat dome, community partners, including Indigenous leaders, city officials, and local organizations, have collaborated to strengthen local emergency response. This was evident this past summer. These partnerships proved critical during the recent wildfires that were experienced, enabling swift, targeted support and evacuation assistance for residents who needed it most. Local teams conducted direct wellness outreach, shared heat safety resources, and helped ensure people stayed cool and hydrated during extreme conditions. West Haven Long-Term Care exemplified exceptional preparedness and an unwavering commitment to resident safety throughout the community response. This team acted swiftly, developing relocation plans, updating site lists, and ensuring residents had go bags packed with their essential items. Food services staff prepared shelf-stable meals and printed individualized diet information to accompany the residents in case they had to be evacuated. Meanwhile, our facilities and maintenance teams played a critical role by installing air scrubbers to improve indoor air quality and reduce the impact of wildfire smoke for the people who lived in the buildings. I'm deeply grateful to the dedicated teams who worked around the clock to protect our residents. And I extend a heartfelt appreciation to all community responders whose efforts during the wildfire emergencies made a lasting and meaningful, life-saving impact. As has been mentioned already this evening, at Island Health, our vision is clear: excellent health and care for everyone, everywhere, every time. And we don't always get it right, but it does guide everything that we do. Our focus remains on building trust, strengthening services, and listening, especially to those whose voices have been unheard. The road ahead calls for courage, collaboration, and care, and this community, we know, is ready. We're deeply grateful for the partnerships, the staff, and the medical teams who make care possible here in Port Alberni and across the West Coast. Your voices and wisdom are essential as we work together to create a future where everyone can access the care that they need safely, effectively, and sustainably. And I want to thank you all for your continued support and partnership.
Thank you very much, Kathy. And now I'm really pleased to have our Vice President of Population and Public Health and Chief Medical Health Officer, Dr. Reka Gustafson, provide an update on the health and wellness of the Port Alberni population. Reka.
Hi, everyone. I'm going to bring that down. So I'm here today actually on behalf of your Medical Health Officer, Dr. Charmaine Enns, who's currently traveling overseas, and who I think exemplifies what was spoken many times today, which is the power of partnerships. So I'm here on her behalf. I'll give you the update that I have. And upon her return, please tell her I did okay. But I just want to say that to me is one of the strengths of public health and healthcare in general is the deep knowledge of the community and the partnerships with the people and the organizations that are there. So today I'm going to focus on a little bit of an overview of the health of the population and then actually refer to some of the health consequences of climate change that you're already experiencing and highlight some of the things that are happening in order to adapt to climate change. Next slide, please. So along with my colleagues, I would like to acknowledge the First Nations, the Tishat, and the Hupachuset. Didn't get that right, but I did practice First Nations on whose territories we are here today. Next slide, please. So a little bit about the population. Who are we talking about today? Well, we're talking about the Alberni-Clayoquot local health area. The community health service area has about 23,000 people, which is about 2.6% of island health. 19.6% of the population identify as Indigenous, so much higher than the rest of the island. The median age, by median we mean the age where half people are younger, half people are older, is 46, with the majority of people being in the ages of 20 to 44. And about 9.1% have immigrated from another country, which is a bit lower than the rest of island health. Next slide, please. Some of the things that are important to how well we are, how well our population is doing is, of course, socioeconomic factors. Most of what contributes to health happens actually outside of healthcare. And these are some of the important factors to consider in establishing good or poor health in the population. One of the things about these indicators that I will go over is that all of them have improved between the 2016 and 2021 census. The green data are 2016 census data, the blue data are 2021. And one of the things I just want to highlight is that, I don't know about you, but for me, 2021 seems a really, really long way away. The world has changed in so many ways, and I'm looking forward to the 2026 census to ensure that we have a good and more robust understanding of the health of the population. But a couple of important indicators. One of the things is that looks at how affordable housing is the proportion of people who are spending more than 30% of their income on housing. And one of the things that we'll note is that among tenant households, the proportion of people who spend more than 30% of their household income on housing has actually declined quite substantially between 2016 and 2021. So before, 51% of people spent more than 30% of their income if they were renters, and now in 2021 it was 40%. So that's definitely going in the right direction, but remains substantially or somewhat above British Columbia and Island Health, where those proportions are in the high 30s. Among households that own their home, the proportion who spend more than 30% of their income on their housing is actually declined and is well below the rest of the population. I'm not going to go through all the numbers individually, but again, median household income has gone up. Low income, the proportion of people living in low income household has gone down. Both of those indicators, however, remain poorer than the rest of the province. The one area that I'd like to spend a little bit of time on is the population aged 25 to 64 with post-secondary certificate, diploma, or degree, which has gone up modestly. But what these data don't show you is the proportion of people in Port Alberni who complete high school. That's been one of the most dramatic increases in island health and a really, really important indicator of future well-being. Next slide, please. One of the things that isn't good news is the life expectancy at birth in the Alberni-Clayoquot local health area. This is difficult to look at. This shows that life expectancy in this region is substantially lower than the rest of island health and has been declining. This, again, for me, this is something that's really difficult to see, so it's sometimes hard to find hope in that. But I do want to say that next slide, please, that one of the places where we can find hope is that many of the things that are contributing to that number are actually preventable. So potential years of life lost is a really important measure that measures not only what people are dying of, but what people are dying of early in life. So what potential years of life lost is actually looking at the absolute number of years that you've lost. So if somebody dies at 40, the number of years of life lost is 35. If somebody dies at 75, their loss is still important, but there isn't that potential year of life lost that is nearly as high. And one of the things that we note is that the causes of potential years of life lost in Alberni Valley that are contributing to that difference between island health and this region are deaths related to accidental injuries, accidental poisoning, the majority of which is illegal drugs or unregulated drugs, deaths related to self-harm and suicide, and deaths related to motor vehicle accidents. So these causes of deaths are all alterable. They're not easy to alter, but they are things that we can do something about. Again, this is just the same thing looking at in a slightly different way, but I wanted to say that accidental injuries, I think the important thing here is that among accidental injuries that we often spend a lot of time on, so motor vehicle accidents, falls, and things like that, but they also do include overdoses that the majority, about 92% of accidental injuries are actually related to unregulated drugs. And so this is something that we continue to work on. We continue to work on as a community with you. We haven't made the progress we have made. But I think it is important that there's that hope in the numbers that working together we can alter them. And one of the things that we have noticed recently is a decline in overdose deaths in British Columbia overall and locally as well. Now, next slide, please. Now, the other thing is, sorry, I forgot to say next slide. So next slide, please. The other thing that we want to look at, and again, in which there is both concern but also hope, is that the most common chronic diseases that are higher in Alberni, in this region than in island health in general, are hypertension, mood and anxiety disorders, and ischemic heart disease. Again, all of these have modifiable risk factors. There's things that we can do as a community and as individuals to alter the likelihood of these conditions occurring. The other thing I want to point out that since the pandemic, since the end of the pandemic, there has been a decline in mood and anxiety disorders. So we're not back to pre-pandemic levels of mental wellness, but I think we are recovering, and that's something that we sometimes forget to notice the good. Next slide, please. And these are data that Kathy really referred to, and no, I didn't have to correct you because you were in fact correct, that the Round 3 Speak survey shows some really good indicators of community resilience and individual resilience. These for all of these indicators, Alberni Valley has been either as good or better than Island Health. And the one that I would like to point out is the strong sense of community belonging. A strong sense of community belonging is community strength, it's individual strength, and it's a very important social determinant of health. Next slide, please. So now I'm going to talk just a little bit about climate change, the local impacts of climate change. And of course, it's one of the most important determinants of health, and it's something that this region has felt very, very acutely and in a very real way this summer. Through the Wesley Ridge and the Mount Underwood fires, which are consequences of climate change, which had impacts on the community in terms of stress, stress about the possibility of the highway being closed, as well as relocation and evacuation of individuals. So wildfires are one of the consequences of climate change, and climate change is being felt in, oh, next slide, please, in a very real way in this region. You would see that the graph on the left is the number of days above 29 degrees between 2010 and 2025 in Port Alberni. And what you'll notice is after some fluctuations, there's been a steady increase in those, in the number of days that are above 29 degrees in this region. And if we try to project to the future, and no, it's not predicting the future, but to try to project what we expect that in the next 50 days, next 50 years, there should be about an average of about 30 additional hot days above 29 degrees and 13 additional hot nights, which are above 18 degrees. So that's a really important measure, because while hot days are an issue, hot nights actually mean that houses and individuals cannot cool down, and there's a cumulative, thank you, had a moment, cumulative increase and health impact for people. Next slide, please. And one of the things that we know is that as with everything, every other determinant of health, there are vulnerable populations. And often it's the same people who are being impacted more severely. So the elderly, those who are managing certain chronic conditions, in particular psychiatric conditions and chronic diseases, and those who are living alone or are socially isolated, were shown during the heat dome to be at much higher risk of heat-related death. One of the things we know when we think about the numbers of, we're talking about the temperatures, at 26 degrees or below 26 degrees, a single day exposure will likely create very little effect for somebody who's elderly or frail. But sustained exposure to 27 to 30 degrees will mean that particularly vulnerable people will have health effects that they need to mitigate. And sustained exposure to temperatures above 31 degrees should be avoided for heat-susceptible populations whenever possible. So those are actual measurable health impacts that we notice at the temperatures that are being experienced in our communities today. Next slide, please. So while we expect increased heat, there's also an already experienced and projected change in precipitation in the region. Alberni-Claycourt will likely also see decreased rain during the summer and more rain in the wet season, increasing the likelihood of floods, damage related to floods, as well as the mental health consequences of floods. The other thing that we know is that in addition to this change in precipitation, not only has the potential impact of flooding, it actually contributes to drought. And that's because the lower precipitation, the higher temperatures lead to a, next slide please, lead to a less snowpack and a less ability to refresh freshwater resources. So the big climate change things that are big effects of climate change that this region needs to adapt to are drought, extreme heat, as well as changing precipitation patterns, creating floods, which seems sort of odd that we worry about droughts, but we in fact know that we have the potential for sudden rainfall in the autumn, creating floods. This graph is showing you the number of days over the last several years that East and West Vancouver Island experienced the highest levels of drought, which are levels 3, 4, and 5. And models are now predicting longer dry spells in the future. Of course, that's something that Vancouver Island has been dealing with for some time. But these periods of drought actually have an impact on our food supply, on our ability to grow food, and as well as wildlife such as salmon, which are really important for our food security. So these are the things that we need to adapt to, and one of the things that I'd like to finish with is just a really important note, again, of positive, of the amount of work that this region is already doing to adapt. While we need to work to reduce the effect of climate change, it's here, it's real, and this community is adapting. There are just a few examples of those adaptations, such as the PM225 air sensor network providing real-time air quality data during wildfire events. That's not a given, not every community has that. So the fact that that has been established in the community with, as well as in First Nations community, is a demonstration of the way that this community is adapting to climate change. The Port Alberni Salmon Roundtable, which I learned about recently, promotes water conservation and monitors fish health under changing conditions. And this roundtable consists of First Nations communities, of commercial fishermen, as well as government organizations. So it's really the community coming together around something that is such an important food source. I'm not going to list all of them. You can read them. There's the beach advisories as well as the regional food hubs. But I just wanted to say that while the health impacts are real and they're here and they're being measured and felt, adaptation is already already happening. So really, I just would like to leave with you with a sort of an overall sense of the health of the population, which is that the sense of community belonging is very strong in this region. I envy it. I think it's a really, really, it's a strength that cannot be minimized. It's a really important strength to build health on. There's encouraging trend in many of the social determinants of health. And again, I think the 2026 census is going to be an important source of information to look at where we're going in the right direction. Decreasing and lower life expectancy is driven by preventable factors. This trajectory can be reversed. Again, I don't want to say that we're on our way to reversing it, because we're not. Some of the things that we need to reverse we're not going in the right direction in our society. There's increased polarization around conversation related to things like substance use and illegal drug supply. Though I do have to say, in the recent UBCM meeting, I felt that the tone of the conversation was more solution-oriented, and I think the overall recognition that we have to work together toward the solution is increasing. And then finally, just the climate-driven hazards. Again, they're increasing health consequences, but Port Alberni is demonstrating a strength based on community-led approaches that are necessary to address these challenges in the coming decades. And thank you very much for your time.
Thanks very much, Rekha. I always worry that we forget how important population and public health is to us, because, like me, we all think about the hospital when we think about the healthcare system, but the work that population and public health has done in ensuring that we are healthier, it cannot be overstated. So thank you very much for that presentation. So now we're going to have a presentation from, and I'm going to try my best for this, Ut Ush Tukyu Society. This nonprofit group focuses on bringing Indigenous ceremony back to the center of healing practices. And it's a real pleasure to welcome and introduce Erin Riding, Tai Hupakinith from Ut Ush Tukyu Society. Perfect. That's great. Thank you. So I just wanted to say before you, come on up, that I turn to my board colleagues at the end to ask if they have any questions of Erin and her team, and then I'll open it up to the floor in case any of you have questions. Great. Thank you so much for being here.
Yeah. I'm on day 9 of a cold, so I'm not contagious anymore, but I am on daytime cold meds, so this might be fun.
Said she'll support from back there.
We also have our board member, Layli Rohani, who is trying to be incognito, supporting from afar.
I'll just do this chant and then turn it over to these guys here. Tlakoya waikashi tlanase tlakoya. Jamachta satanatya atitlahoyi waikashi tlanase. I'm Shusi Ada Hata Kukanat Nanaksoya. Chew, Tlakowana Shako, it's a shot. Who pitches it? Tlayo hot chitniwa. Tlayo hot chitniwa. Tlakowanish. Ako. Istak chitni shako. No chanat. Go clanisha. Ut ustakyo. Tlako. Leah, Hitlap Neoako, Hamchit, Paichit, Tlawichit, Chukwawa, Tlako. Thank you. We come from the Utushtak Society. It was formerly called Tsayuk. And it was here for a long time. The last ice age, we have songs about the last ice age. So we've been here a long time. And Tsayuk was the health society. It was the health service for all the people in Newchannel area. We worked with from people from conception till transition and post-transition. And transition means death to a lot of people. So we worked with the people as a health service. And when the Indian Act was enacted by Canada, our services were outlawed. But thankfully, there were some Ushtaki that said, we need to keep this alive. So they went underground and kept it alive. But about 15 years ago, maybe 17 years ago, we got to group together again. Those that have been taught from very young age, like my brother here, Anit Nas. He's been learning since the last 70 years, maybe 75 years he's been learning. And we carried really in our hearts. We carried in our hearts because it is important for our people. It is important for our people to know who we are and what we are. And it excites me when I hear you say reconciliation and collaboration. And that makes me excited because we would love to shake hands with our medicine and with your medicine. Because we know that Western medicine has done a lot and has had many advances in science and all those things. We recognize that. And we don't take anything away from you. We hold you up and say, yes, you're doing well. But also, we recognize being human beings, we have shortcomings too. We have shortcomings. And this is where we come in to help collaborate, shaking our hands with you, with our medicines. And we do it much like your physicians and your workers. We operate 24/7. We work 24/7. And Aaron will elaborate more on that. But we're here to say thank you for inviting us in. Thank you so much, Leah. Thank you to the Hupachasat Hadachashat Nation for allowing us to come here and do a little bit of work and presenting something. It's an honor to be here, to be amongst people much like ourselves, people that serve in health. I thank you for letting us be here today. I appreciate it, and we really look forward to shaking hands and collaborating.
That was Dave Frank, Hichismia, our Chief Medicine Officer of the Utushtaqu Society. Chuch Uklasish Kushin Aksa. I'm Aaron Riding, and I belong to the Smith, Pashley, Cotton, and Riding families of England, and the Campbells and the Montgomerys of Scotland, and through marriage and adoption, the Petoulises from Greece and the Atlios from the House of Clackashby in Ahousaht, New Charlotte Territory, and I'm the Tayuba Quinish of the Ut-Ushtakyu Society, so the administrative director. My work is to keep up with, or try to keep up with Dave and JC, and the 20 other Indigenous medicine practitioners that form our network. And so we are a nonprofit society. We are into our 4th year of incorporation. Before that, we worked as an initiative under the Ahousaht Nation, and previous many years spent trying to figure out how to bring this work out in a safe way, in a good way, into the formal healthcare landscape as it exists now. And I'm a little bit out of breath. Whew. There are many individuals who do not think that it's safe enough for this work to be brought out, that because of the ongoing systemic racism, we can't do it in a good way. And that's a really important thing to hold as we walk forward in these conversations, in this work, developing these services. We are recentering Indigenous medicine within healthcare services for Indigenous people and non-Indigenous people to access. So we do a number of different things in our society. We do plant medicine consults, prescription, and follow-up. We do ceremony, as Dave said, from conception to transition. We do a lot of crisis response, and we do a lot of mentoring and a lot of training to ensure that this knowledge moves forward. We've developed a really robust community of practice among Indigenous practitioners, which has been a really remarkable thing. And our work is about protection of Indigenous science, Indigenous medicine, Indigenous ways of knowing and being, acknowledgement, supporting our institutions, our government to acknowledge the legitimacy and authority of Indigenous medicine models and the right for Indigenous people to have access to those models. And we do that that is a part of every piece of the work that we do. We have around 20 practitioners that live across Vancouver Island. Many of them have strong Nuu-chah-nulth ties and have ties to other nations across the island and across BC. And we work virtually, we work remotely, we work in person, on reserve, in urban centers, in community centers, in homes, in hospitals. We work everywhere. And we've had, Dave talked a little bit about shaking hands with each other's medicines. We want to always blend best practices and wise practices from anyone who wants to work with us in a good way. There are a lot of different models of care out there, and anyone that centers individual humans in our spirits, our minds, our bodies, and the territories we live in, we would welcome the work together, because we are all facing really complex realities that we have no precedent for. And our teachers teach us that when we bring the best of each of our individual minds and hearts together, whatever we create is stronger than when we're apart. So our work with Island Health, with Jess and her team at West Coast General, has been really exciting for us. In the last few months, we've partnered to be able to provide 33 hours of service from 3 Ushtakyu to support Indigenous staff and other staff at West Coast General, which has been really great. In the past, since January, in 2025, Ushtakyu have delivered 320 hours of service apart from those 33 hours in hospitals across Vancouver Island to Indigenous patients. And that work is currently funded by the Catholic Church. So we're excited to come and share. When we put those numbers together, we'd be like, that's affirming. Often that work has happened through referrals from Indigenous liaison nurses or are coming directly from family members. And so we provide support pre-surgery, post-surgery. We provide a lot of transition ceremonies in hospitals. We do a lot of work supporting folks who are experiencing trauma, substance use, addiction issues, suicide, ideation or attempts. A lot of support for families who are supporting their family members who are in hospital. Yeah, the work with, we've done some work with Tofino General as well. We've done a number of hospital building cleanses and work with their staff and their patients. And it feels like our relationship with Island Health is growing. So we've also received an IHIP grant last year. This year we received the Island Health Youth Resiliency Project grant. And so it feels like over time, our relationships are growing in a good way, and we look forward to the work that is to come. Our core funders at this point in time, just so you know, we work with FNHA. We hold the Traditional Wellness Coordination contract with FNHA for the Nuu-chah-nulth territories. And our other core funding comes from Ukwink-Panach Society, the West Coast Indigenous-led FNPCI. So that launched last year. It's been a really incredible thing to work with them, and that provides us funding to support the 5 nations on the West Coast. Yeah. I think I could go on, but we have, we'll just open it for questions. Yeah? Yeah.
I just want to ask my colleagues, thank you very much for that. That was fantastic. We are on a learning journey, and we very much are trying to understand reconciliation and collaboration. So thank you for being here. It was excellent for us. You're amazing.
Thank you, Leah.
So my colleagues, questions?
Hi, good question. Erin, that was a really good presentation, and I'm glad you got your guys here too, the Ushtakyu.
Me too.
I was wondering, because you said that you offered service to a variety of places on the island. How would people access your organization?
We get this question a lot, and I think it can be frustrating for folks who are used to working in highly structured formal systems to understand, and I'm learning also how to communicate in a good way. So we have multiple pathways to access Ushtakyu. We try to be as low barrier as possible, and our work has originated from community and is embedded in community. So a lot of Nuu-chah-nulth community members know how to get a hold of us. They get a hold of us through Facebook. We have a public Facebook page for medicine seekers. We also have a website that has a contact email that folks who haven't connected with us before, we recommend that as a first point of contact. And then also we operate relationally. So give me a call or a text, save my contact, get in touch whenever you need to. We have a team, Dave and myself and one other person are our little administration crew. Nadine is the other one. She is the person behind the contact email. And so the 3 of us do that administrative work. We try to connect folks with, if it's individual requests for medicine, we connect people directly to the medicine maker of their choice or the medicine practitioner if it's ceremony of their choice. If it's a group request, then we go through the admin team. Yeah.
They brought out an extra mic. I'm imagining that the community out in the virtual world didn't hear Shawnee's good question, but obviously very impressive work, not only what you're putting out, but even just the gathering of the leaders and the healers and the knowledge keepers. Are they all known to each other? Like, they're obviously, JC is very, very well known in the Friendship Center circles and things like that. How are they connected to each other or to the group, and how do you find them, I guess?
That's a great question. Yeah, they're absolutely connected to each other. So this work, this society was created through their work, and the structure of a nonprofit organization is a little bit of an ill-fitting suit. It's the best option at the moment. We look forward to when DRIPA comes into effect, and we may be able to have more Indigenous ways of organizing. At the moment, our Ushtakyu are our general membership. Our board of directors has 6 people on it. 2 of them are Ushtakyu. And then we have a council of wise elders that are all Ushtakyu that advise the board, the general membership, and the administration. And we're all contractors for the society. We started before COVID, and we were funded through the Mental Health and Wellness Tripartite Agreement. And when we were just launching our formal services when COVID hit, and a lot of our Ushtakyu had talked, because we do everything in circle, we make decisions by consensus, were not comfortable with computers, but the deeper teachings came into effect, and for myself, I came to realize how these practices last for thousands of years, because the values of doing what works, doing what needs to be done, always to find your way forward in a good way, came into effect, and we went virtual. And our Ushtakyu met every week for 2 years on computer, on our Zoom account. We have a membership process. It's tricky because of where we're at this stage in our society. There are a lot of people that have been hurt by cultural leaders. There are a lot of, everybody's still doing their work. So it's really important when we are bringing this medicine model out, that it is safe, that people have choice, and that that protection in part comes from community, from everybody doing that work together by having a really strong professional community of practice for our Ushtakyu. Does that answer your question? Yeah.
Great, thank you very much. I just want to see if anyone in the audience has a question. Well, thank you so much. We will look forward to continuing our relationship with you, and I'm so delighted to hear that you're being welcomed into our hospitals and facilities. And I think if you've really got connections, I'd have one of those medicines. Well, that wasn't what I was expecting, but it was so amazing. And we will look forward to getting an update from you the next time we're in this area. That was really terrific. Thank you. So now I want to open the floor to questions for the Island Health Board. I ask you to keep your questions really brief. We're supposed to be wrapping up in 13 minutes, but I'm sure we can go a little over time if we need to. Leading up to this event, we asked you through social media about the health and care issues that matter most to you, and we invited people to submit questions via email. We appreciate everyone letting us know what they're concerned about. We heard about a variety of areas you're interested in, including timely access to physicians, specialists, staffing shortages, the quality of care and patient-centered approaches, as well as the desire to see more government and health authority investments in your community. We appreciate hearing what has mattered to you, and that's why we hold this public forum. So thank you to those who contributed. I just want to see if there are any questions. So I was given a couple to ask in case we haven't got any questions from outside. So Kathy, I'm going to ask you this question, and here comes the mic. What is being done to support youth struggling with mental health and substance use issues?
Yeah, thanks for that question. I think that weighs really heavily on all of our minds, and those of us who are parents and who are trying to guide young people through the world. As Aaron just described, the world's a different place now than it was before this pandemic that we've all experienced, and we are very concerned about the impacts. In particular, Dr. Gustafson spoke of some of those unintended consequences of the pandemic and the impact that's having on youth mental health. And we have a team, actually, Shauna is here in the audience, in the room, who could speak to the details of a program. But what we've identified is to treat children and youth, you need to have a specially focused program. It just can't be a general mental health approach. How children and youth access services, the types of services, how families play a role, it's very different than in an adult environment. And so I know, Shauna, you've been doing lots of work to develop youth-specific mental health services. Do you want to add some color in terms of the specifics? Because I think we only have one that's working.
Thanks. My name's Shauna, and I work for the Health Authority as a Clinical Services Director for the Child, Youth, Family, Mental Health, and Substance Use Services. And over the last few years, we've actually been able to make some investments outside of the Victoria area and in other communities across the island. So specifically in the Port Alberni area, we've added a team that we call Y-STAR. It's a youth short-term assessment and response team. It's a multidisciplinary team with nursing, social work, and outreach support. They work 7 days a week. They do some in-reach to the hospital emergency department as needed to support, and they work with young people and their families who are experiencing mental health and substance use challenges. Very low barrier, very accessible. A young person does need to consent to the service. It is still a voluntary service, but they will support young people with accessing harm reduction supplies, with some community-based outreach, with connection to other services such as child psychiatry consultation, access to addictions medicine if that's something that a young person is looking for. And they also try to help navigate our very complicated system of services for young people, which involves sometimes multiple ministries and other service providers. Other services we have in the Port Alberni area is a team called Integrated Child and Youth Teams. It's very early days and just getting up and running, but provides service not only to Port Alberni, but also to the West Coast. It's, again, a team of counselors and peer supports through the school district, through Ministry of Children and Family Development, and then also some health authority services. Lastly, we have a relationship with a group and community called ADAPS. They're a community not-for-profit. They hold a contract and provide mental health and substance use counseling services to young people and their families. They're also the lead agency on a Foundry, which is a very exciting initiative that's receiving some funding here for the Port Alberni community. It is a multidisciplinary primary care sort of hub for young people. They provide, again, substance use, mental health services, peer support. They have a Foundry Works in Education program. So really an amazing initiative that I believe they've got a site, which is always the biggest barrier, is finding a space to operate those services, and looking forward to developing and standing up that service and opening the doors to young people in the community. But again, always work to do. And as I say, in our service stream with child and youth, we have that added complication of a few different ministries providing the service, so not just health, but also the Ministry of Children and Family Development. So we do lots of collaborative, integrated case planning meetings and really try to wrap ourselves around the young people and their families as much as we can.
Great, thank you very much. That was an excellent answer. And you know, I just want to say before you, or as you sit down, how much we appreciate your work and the work of all of the staff at Island Health who care about people so much that they come to work every day and look after them. So thank you very much for that. So I have one other question, and again, I'll direct it to you, Kathy, and you can decide who you're going to finger to give the answer. What are you doing to make healthcare more accessible in communities?
Oh, that's a big question.
It is, it's a big question.
Healthcare more accessible in communities. So I think that may be getting at primary care. Yeah. So working here locally, and I don't know if Leanne, if you're comfortable speaking to the primary care work here locally, or Max, if you can speak to primary care. So I know there's quite a bit of work here, and the PCN has been funded here. So PCN is Primary Care Network, which is an initiative that the government has invested to connect community primary care providers into a network. It's the easiest way to say it. And add other members of the healthcare team so that they have access to a full continuum of service delivery in community. And there is a primary care network here in Port Alberni, and there's been quite a bit of work to get that up and running. As Sean has already pointed out, some really interesting and work to develop some programs for children and youth in community. I don't know, Max, if you'd like to add more detail in terms of accessing healthcare services in community, or if other members of the team, but I'll tag you first. How's that? Or you can stand there at the podium.
No, really great. I really appreciate the question. I think that it's such an important question. So I'm Max Yashchuk. I serve as the Executive Director for Clinical Operations in the Centre North Island. And I'm a registered nurse as well. What I find that's super important about this question from the community is what are we doing about community-based services, and how are we growing those services and making them more accessible to people within Port Alberni? So what we saw in Kathy's presentation earlier is that there has been a significant growth in community-based services for individuals who need scheduled care or care within their homes or within their communities. We've done a really great job to be able to recruit additional people to be able to provide home care and home support services, helping individuals with their chronic diseases to be able to live healthy and at home and be able to receive care in their homes. And we continue to look at growing those services. We have an access center. If you Google Island Health and home care access or community access centers, you'll find a number that anybody can call without a referral to be able to talk to one of our staff, to be able to talk to their healthcare needs or what their challenges are, and to be able to be connected to a nurse who can do an assessment to understand what an individual's needs are and get them connected to home care services and home support services. So in partnership with growing primary care, a significant amount of growth in being able to provide services for individuals to stay healthy in the community. And then there's those other pieces around how we support people to be able to receive diagnostic services, so the really great investments in the hospital for X-ray and CT scan, and being able to provide more timely services for individuals with much better and greater technology. And of course, we expanded the emergency department. So we have a modern emergency department that's providing a better service, that's larger, and with more healthcare providers within it as well. So we know that most emergency department services are for people who come for a specific need and go back into the community. So one of the other pieces is we have individuals now within our emergency department that are helping to link those individuals that we see for maybe the first time in the emergency who need home care or home support with home care and home support as they leave the emergency department as well. So a really great question. The key message I want to leave is anybody can call the number and to be able to get access to somebody who can speak to what home care services or home support services might be available to them.
Thanks very much, Max. So I mentioned in the beginning that we were a governance board, and as such, we're accountable to you and the people we serve in communities. And that is why it's so important to provide opportunities like this for us to hear from you. I want to thank everyone who submitted questions or stood up to ask a question. We didn't have very many of those this evening. I hope we've addressed some of your concerns today. Please be assured that we are actively listening to your needs and concerns regarding your health care. Thank you to Kathy, Reka, and the Utushtuku Society for that excellent presentation. I'm looking forward to hearing from you all again. And thank you to everyone who came today or turned into our live stream. I'm also very grateful to our multimedia group who help us engage with you. So they're all over the place here, and thank you very much for always coming, putting us on air if that's what we are doing that particular time, and for just setting us up so that we can have these conversations. It's very much appreciated. And so I'll close the forum, and thank you again for taking time to join us this evening.